Today is World Seniors Day, and I thought I'll get into a conversation with Raj and Dr. Reema, the co-founders of Lifebridge. Then I have been talking about how unprepared we are for taking care of our life, which is the next phase and probably the defining phase of how we live for 20, 30 years, when everything that we've done in the past and what we do now will be very, very different. So I spoke to Raj and Rima and said that we should get into a conversation to discuss this, and they agreed. And so here we are with this conversation, and especially on this National Senior Citizens Day. Uh, the objective is to understand what is it that we can learn from the senior citizens' life so that we can be prepared for our life 2.0. Raj and Dr. Reema, thank you so much for taking out time for this conversation, because I think it is really important, because we were talking last when we met. We thought that we'll discuss what is happening in the industry right now. Uh, what I'm seeing is that Raj, life takes us by surprise, and what we plan for and what actually happens later on is very, very different than what we had thought. And I'm cautiously using the word happens, because it's very subconscious, and this then we suddenly realize that everything is beyond our control, because we start getting a feeling of that, I wish we could have done this. So there's a lot of regret on the hindsight. And I had a few questions that I really wanted to, deliberate with you and Dr. Ema. And so I thought I would request for this conversation. What I find is that we start preparing for our children's education. When we are 30 and our children are growing up, we start planning what school they should go to, what board they should have, what college should we prepare them for, even when they are not even in their class 10th grade, you know and we build our careers. We have aspirations, we have a vision of what we will be, whether we'll be sitting in a corner office or we'll be becoming an entrepreneur. We start planning buying our homes. We start looking at how much money should I save to purchase my next asset, whether it's going to give me returns or not. uh, I don't think many of us, at least that's what I have observed about my life and people around me, we are not planning for something which is beyond what we can envision. We forget that one day we will not be working, or we will not be actively involved in our profession. So the question that I had, and which I want to deliberate with you guys today, is that when do we actually start preparing for our later years? Or uh, should the conversation start when we are like 30, 40, 50, when we still have time and the ability to influence what those years could actually look like? And so that's the conversation I want to have today with you, Raj and Dr. Reema. Uh, Raj, why do you think people in their 40s and 50s don't even think about this reality that all of us could be facing today?
Thank you, Harbinder Ji. As usual, it's a pleasure to have great conversations with you. I've always enjoyed those conversations, and they're very meaningful as well. And I think the topic that you wanted to talk to me and Dr. Rima today is so exciting, uh, and it's so realistic because if you take my own case or my own family, I think all of us in our 30s, 40s, and probably even in 50s are very busy running after certain things in our life. In the early days, it's about us and our career. And later on, we start talking about our family and then about our children and their career, etc. One of the things that have struck me over a period of time is that none of us believe that we'll become old, actually, and uh, everybody thinks we are going to stay, whether it is my own mother who's in her mid 80s, or it's myself or others, I think, whom I've seen for quite some time. I think the nobody thinks that they are going to get old. And then comes the discussion of saying, am I getting prepared for the what we call it as the second innings and the life beyond 60? But my last 8 to 10 years, having been in this field of providing care for the elderly and providing, taking care of active seniors, I think has really brought into fore many conversations which I've had with many of our wonderful seniors and their children. And I think of late, the centricity of these discussions hovers around what happens beyond 60. Are we all prepared? Are we really prepared? And I'm not just talking about the healthcare connotation or a living connotation, but the beauty of this discussion is it's got a 9 yards of stretch which you can really ponder and go into depths. So yeah, I think my personal experience has been that in India or in our own communities and societies, we have still not started an aggressive dialogue on how do I plan my tenure beyond 60 and my life beyond 60.
Awesome. And that's very interesting when you talk about the second innings, you just called it, because I think most of us have a very vague idea about what aging could look like beyond what we have seen our parents. And we sometimes, I think, we are unable to accept that fact that one day we will also be aging. I don't say we don't think about it, but we think about retirement, we think about health problems only. And we assume that our children are going to be around us looking after us. But perhaps that's exactly what the problem is. There are too many assumptions of what the life could be like. Dr. Reema, since you guys have been into senior care and you spend a lot of time with people in the age group of 70, around 70 or so, what does aging actually look like? What have you observed when you look beyond the medical issues? I mean, I know you're a doctor, but when you look at a lens which is beyond the medical issues, what does aging look like in reality?
Right. Thanks, Harbinder. As usual, pleasure to talk to you. Um, I'll take a step back and also add two more lines about the earlier question that you asked. So, two things that I see missing is also realization that we will reach there, or there is, and lack of acceptance that that is what we are going to be. I mean, we understand that when we are 20, we are very, very active and doing certain set of activities. But when we are 45, we are doing very different set of activities. Accordingly, every 20 years brings in a different set of activities which we have to accept, adapt. It's very important. And I think in as a culture over here in India, we are not talking about old age. I think it is to some extent it's a taboo, right? This is some of the things, a phase of life which is going to come and we don't talk about it, and that's the reason that we are hit upon that, oh, now what, you know whether it is health or whether it is non-health part of the aging. So just wanted to add that to your previous question also. And coming to the care, the health part of it, exactly, I think it is the same route or the journey that it takes. We always think that nothing is going to happen to me. As a clinician, I have all gone through this, that somebody else has gotten a disease, we always feel that, oh, this is something that is never going to happen to me. And that's the same thing we think about age also. I'm never going to grow old. I'm going to be a different old. Or maybe and we just keep putting it under the carpet and not talking about that when I am 65, forget about the professional life, forget about other things, that what is it that I am going to do? We never think about it, right? And when the time comes, we don't know what to do because we have not put the thought through it, whether it is companionship, whether it is um, traveling, whether it is keeping yourself physically active, so that you would have worked out earlier to see that, okay, I'm independent. Do I create a new purpose for me in my life? So these are the few things which add a lot of stress on the health part of an individual also. And when we talk of health, it is just not the physical health. It is about the emotional, social, psychological health. So we see at this point in time, we see that people haven't paid too much attention. They just landed where they are there today. And then they start thinking, and it becomes very difficult to change yourself or modify with the times or walk with the times, right? I remember my mom telling me that her grandfather used to say, walk with the times. If you are fast, you will be alone in front. If you are slow, everybody would have gone in front. So basically, it is always better, whichever age group we are in, we should be in sync with the time. Whatever the time is asking us, we should be able to, equip ourselves and adapt to it. It is, as Darwin said, survival of the fittest. It is just not the physical fitness we're talking about, but the overall.
You know, I love what you said that, rather than just looking at physical health, we should look at emotional health, psychological health. And I love that term that you spoke about your grandparents saying that, walk with the times. That's a very powerful thought. So perhaps we're not just preparing for a financial event called retirement. We are preparing for an entirely different phase of life. Raj, if you had to tell a 50-year-old today that here are the things that you must start thinking about now, what would be the things that are going to be there on the list?
Very interesting that you asked because I think recently we were in Japan, spending some time with some of the senior living facilities or assisted living facilities and interacted with many elderly people over there. One of the brands that we interacted, we found very interestingly that they created a comic book which was basically circulated among school children, which basically brought out a lot of awareness of what is required to take care of the older persons in their community, not only in their home, but in their community. So I think it's such a beautiful question that you asked. I think the first thing that I would possibly want to do with the 15-year-old, or I would have loved to have had that in my growing times, is basically to bring out in the manner that they can actually understand the importance of caring for the older persons in your home and in your community and in society. I think that's very, very important. And that has many connotation to it. Whether you respect the elderly person or provide support, spends qualitative time with them, so on and so forth. And it was brought it in a very nice comic way in the instance that I'm talking about. So I think the first and the foremost thing that I would like to do when I interact with these 15-year-old, and these are the people who are going to be the torch bearers in the future. And I think that's the first thing that I'll try saying that, how do you care for the older persons in your own community?
Fantastic. And Dr. Reema, that is about a 15-year-old. What about a 50-year-old? What do you think they should be doing right now to define what the 70-year-old, their self at 70-year-old would look like?
I think they have to, first of all, they have to empathize with the age. Age has to be considered as a condition, if I may say. Everybody, if it is a disease, we can hope that we don't get it. But age is something that everybody will get it. So one is empathize with the age. So what I'm trying to say over here is that whatever older people are feeling, assume that you will be feeling the same thing, right? So then it is intelligent enough to say that, okay, I will also go there. What is that I can do today to feel better when I am 70 or 75? And again, it goes back to my previous thing that I said. Pay attention to your physical and emotional, mental health at this point in time, because now you are done. Kids are gone, had a great professional life, and all those things are done. How much attention did you pay to yourself? Right? That is something that, at 45 or 50, every human being has to start talking about. That let me build myself physically or emotionally as an independent individual, not wanting anything from, if you get it from outside, it is a bonus, but otherwise, try to build yourself as a, institution. I think that's what Buddha said. That's what all the, great people say. That, just be happy with yourself, kind of a preparation that you can do, and what else comes from along with that, I think it's a bonus in life. So prepare physically, emotionally, and mentally. Create friends, create communities, create social connections, that you have a great, engaging, and a fruitful life going forward.
Anything, Raj, that you want to add to
Yeah, absolutely. I
somebody in
think
our age group should be doing?
No, there are two things I wanted to add to this conversation which you had with Reema now. One is, I think, there are four things that are very certain in life, which is birth, disease, old age, and death. That's something that's very firm at this point in time. And we people who come from healthcare actually deal with the entire spectrum that we are talking about, which is very certain in life. Other things are, uncertain to become rich or not. It can happen and may not happen, right? So one of the interesting things that we are, so I just want to top it up by saying that, it's so beautiful to even look at the definition of health. You know, it says the definition of health, it says, very clearly that it's not just absence of an infirmity, but it's basically a overall well-being, including your mental, physical, emotional, social, and spiritual. So if anybody understands health today, it is not just about a hospital or a clinic or nurse or medicines. Actually, the definition of health encompasses all these five, six elements very beautifully packaged together. One interesting thing is, having been in this field of providing care for the elderly for the last decade, I think I can very clearly see a shift happening in the last few years, where when we interact with more youngsters, and I say youngsters in the age group of 40s, in their 50s, who are doing extremely well in their professional life, we are seeing a conversation that's happening now. Whomever we meet, whomever we interact with, everybody's relating it back to either their parents or their own selves. So the conversations becomes very interesting and very enriching as well. So I can see a very clear shift that's happening. Conversations are starting to happen, and conversation that people like you and we have is also going to fuel these conversations as we go along, which will help to build a greater society as we go along.
Absolutely. So, Raj, you use the word parents, children, and you use the word society, right? Uh, there's another reality that I think has changed dramatically in our society. We in India had traditionally been, we had large families, we had extended families, we had many children. I mean, I've seen our parents who were typically four, five kids, and today we are in a family environment where we are lucky if we have two kids. Otherwise, typically we have one child. And another thing that has changed is that our children may not be living with us as they grow old. They may be in a different city or in a different country altogether. Uh, and even if they love us deeply, they may not physically be there when we need them, right? And it does not mean that they love us less, but it's just their own life which they are dealing with. Dr. Reema, you have one of your daughters. She's pursuing her career studies overseas. Do you think we need to change the way we think about independence in our later life? I keep saying this that, it used to be a senior who were in dependence on their children. And today we take pride in saying that, we want to have independence in our later life. Is being independent actually something that we should prepare for rather than something that we should fear?
Very valid question. And I think there is nothing to fear about. I think it's just the history that we are talking about earlier when our parents, our grandparents' time. I think largely it was financially dependent independence, I think. And nowadays, most of us are doing well, and we don't expect anything from the children. Like, they have their life, they have their dreams to pursue. um, I think the only dependence that I would probably expect the children to have is in the form of empathy. Logistically, if I'm sick, etc., if I should be able to check myself in the hospital and take care of logistical. We don't have to. We have to create a system around us that this logistical help is taken care of. You know, and if kids are there to acknowledge our presence, reach out to us for certain kind of advice till certain age. Of course, at certain point in time they overtake us because they are in times. So, the expectation should be, I think we're more realistic to the whatever times we are in. I don't want my daughter to leave whatever she is doing because I'm unwell. And I don't want my kids to think that it's the pressure that I have to get back to my parents and how do I decide my life forward. I think we are putting more pressure on the next generation rather than enabling them. I think our independence of the older generation enables the younger generation to make the world better, I think, by themselves. So they are working. So it's we have to pursue and work towards doing things by ourselves and creating societies or new norms or new societal norms, to ensure that we are happy and we make people around us comfortable and easygoing. So I think that's the pressure, that if we could take it off from the kids, that bro, I don't have any expectation of, we don't have any expectations. You pursue it. Whenever there are good times or bad times, we get together and you acknowledge our presence, and that's it. That's great.
Yeah,
That's
that
what used to happen in older times, right? The phases of life, the vanaprastha, you would just cut yourself off. You would go away, somewhere that you're in not touch with anybody. So here it's an evolution of vanaprastha, I think. Here the elders are realizing that we need more than seclusion. Let's create something like-minded communities and have a good time. And we are going to be living longer now, so let's live happier.
but what I've seen is, and internally, when you are in your 50s or in your late 40s, you do everything and anything for your children. That's what defines what we are doing, what investments we are making, what assets we are building. Raj, what just Reema's mentioned, does that change the way what a person should be doing when they're in their late 40s and 50s now with the changed circumstances, empty nest being the reality that we are looking at?
Yeah, I mean, the only change is that please take care of your family and children, but also start planning for your, the second part of your life. So that's the only message. So I think the whole concept of planning should also include your own self into that bucket, so that you start looking at how. And I tell you, Harbinder, the very important thing is especially financing for your second part of your life. That's very, very important, right? Because you are looking at, you mentioned very clearly that we look at creating some corpus for the children, their education, their safety net, etc., and all that. No, but I think it's going to become very important. This is one of the conversations that is happening around relevant circles now about financial freedom for you when you turn 60, because in all probability that you may stop going to your routine work because of the so-called retirement age. But then how are you going to make sure that you're going to have some continuous flow of money coming into you, which is retirement planning in that sense from a financial planning perspective. So I would just throw in one more element into that bucket when you're in your 40, and that element is about your own self, which people like me feel that we could have done better also in the past. Yeah.
Yeah, this is extremely important what you just brought up, because you know uh, what I've seen in the Indian society specifically, uh, as parent, you hate to be financially dependent on your children at whatever age. So it's also a psychological issue. I think one of the regret that I feel in senior age, what people could be having is that they don't want a financial burden on their children because of their health,
Yeah.
etc. Another very important, when you're talking about health, and Rima, you mentioned about psychological and emotional health, there's a very important aspect that we fail to discuss. We don't like talking about it. And because when you're in your 50s, we if you speak to people around, when I go for socializing among my peer group, we always hear this very cliched thing that it's time that we're going to be growing old together, right? But statistically, one person is likely to eventually spend some years without the other, right? And some people will be divorced, some may be separated or widowed much earlier. uh, so, Rima, should preparing for a later life also mean preparing emotionally for the possibility of living alone? It's a very hard thing to talk about, but should you prepare for living alone?
I think it depends upon person to person. But if we look from the science perspective, human being is a social animal, basic definition, right? We keep hearing this. So it is, that means that is the norm. Living alone is not a norm. You are trying to do something which is not natural. It definitely is going to be difficult, right? So, why should we even think about something that is difficult? Why couldn't we evolve into a society which talks about companionships, right? So, why should, maybe there are friends, maybe there are close friends, maybe there are, and as we grow older, the connotation of companionship changes altogether. So, I think preparing for loneliness is not the right that I would, or input that I would want to give, or says what I would like to add is explore to be with other human beings so that you are enriched, and always when we get back in the evening, the sun dawning that we call it, even in dementia we call it, that's the time when the human mind kind of gets a little bit more what do you say, in need of socializing. I think we should be able to address that and not evolve ourselves to loneliness or anything else like that, but evolve into a society which we can look out for each other more, talking to each other more, or having a companion, having new friends, etc.
You know, I tend to agree with you. And what I feel is it's not necessarily a very depressing thought. I don't know, perhaps it's actually very empowering to know about it, accept it, and if
Yeah.
I know what I need, I can prepare for it while I'm healthy and while I'm surrounded by people. You know, and let me ask you both a question. Let me make it actually personal, because we are all in a very similar age group, where we can still take some action. I think, when I look at myself, I feel this is probably the last opportunity that I have where I can define, where I have the power to define what my life in the next 20 or 30 years could look like. And Rima, I would encourage you to look at it not as a doctor, and Raj, not as a business leader, but just as a person who knows yourself today and what you know about yourself today. What would you tell yourself to start doing differently today, since you have been spending time with seniors, knowing what happens, knowing their lifestyle, and putting yourself in their shoes? What would you want to do differently today that defines how you desire to live 20 years later?
I think that's a very brilliant question, and the beauty of being in this profession is basically that question keeps haunting you very frequently, but especially of late. I think for me, as Reema also mentioned earlier, I think it needs to be a holistic kind of a thinking, taking care of you physically, emotionally, spiritually, and financially. All the pillars are very important. There are few pillars which probably I am pursuing, but there are few pillars which I am not. But I think, what you said is so beautiful, Harbinder Ji. Is basically saying, let me assume that today is the last chance I have. Now, it's not the last chance for you, but only when you assume it's the last chance, you'll be able to act on it immediately. So I think that's the essence of what you've been pointing towards. I think I'm also one of them who has realized that there are a few pillars that needs to be worked on. As entrepreneurs, Arvind Ji, we spend most of our time just breathing and living this particular business world. And I come in first, or we come in first, and we leave last from the organization. We have got great set of team members, but our life has always been around the business. Even when you are spending some time with the family on a Sunday or a holiday, you still keep thinking about the business. You get calls, you talk to people, and especially in this profession, there is no breaking away from any of your routine, because we get calls from children from the US and other parts of the world. For them, the timing is so different. So you will get early morning, late evening calls for you to talk to, and you cannot shy away from those calls. And I think, there are a few pillars that I have realized that I need to work on, which I've already started. I am sure there are many people like me who are on those kind of journey where few pillars maybe is looking good, but there are few pillars that they have to strengthen. And I think the right time to start, as you rightly said, is now, because you really have, you could have, as long as you live, you can live a great life.
Yeah. So
Reema, you add something to
yes,
this? What,
yes,
what,
for
what
sure.
is it that you will start doing today?
I'm sorry.
What is it that you will do
Ah,
right now at this
right.
age that will define how you would live 20 years later?
Yeah. I think it's not about me only, but I would probably, ask others also to do. I call it triple A. Accept whatever the situation is at this point in time. Accommodate, adapt, sorry. So they're triple A's. I think easy said than done. I think I'm yet working towards it. I was also not able to achieve it. But I think as we mature or age, maybe these one or two or the three of the A's will be able to practice much better. That is one. The other thing that I personally believe we fail to do is we wait for big things to happen or big happiness to happen. We forget to live the moments, small moments on a daily basis. Maybe you could have 3 4 moments a day which would make you feel nice, rather than let me just cram it up everything, let me cram, and then probably over the weekend I will go somewhere out, do something for myself, etc. And then on the weekend something else falls on your head and you're not able to do that. So I think it is not about, we have to, what I would want to start practicing is that live each day rather than waiting for one of the days that I'm going to be doing certain things. That I think adds daily nutrition to our soul, small amount rather than a huge bolus once in a while. And then in between there are, again, I always go back to thinking like a clinician, when if I may use the analogy over here of insulin, right? We always say that the insulin, you should not have peaks and troughs. It should be hovering around the threshold. Personally, I feel that human emotions also has to be hovering around the threshold, and it should not have peaks and troughs. Again, easy said than done. But of course, we are human beings. We need to keep practicing and seeing. Everybody has a different comfort zone. Everybody has their own plane of comfort. I think everybody needs to identify that and work towards that and ensure that we are hovering around the threshold rather than being very happy or very sad or things like that. Yeah. So that those are the few things that I think I should do. Practicing it, let's see how far it goes and how well it changes.
I think this is where it gets interesting. The conversation that we are having is becoming interesting. Perhaps, what I realize is that we've been always asking a very wrong question. At our age, we keep thinking about how will we take care of our seniors, right? But perhaps we should also be asking, how do we help people prepare for becoming seniors? Because what I'm sensing after talking to you both is that we know the reality, we will get old, but like you said in your triple A, that acceptance nahi hai, कि I don't think that I will get old, I'm still strong. So we can't envision ourselves in that particular or we don't want to envision ourselves. And because 75-year-old tomorrow is the 50-year-old of today, right? So do you agree that we should, I personally feel that there should be more conversations that 50-year-old needs to have around senior living than a 70-year-old who probably feels that, अब क्या कर सकते हैं? What do you think about this, Raj?
No, I think, look, certainly when you cross a particular age, I think currently the mindset in the current societal context is that people tend to give up a bit easily as you age. So it's better to start thinking about these things when you are actually having an age at hand. So it becomes very relevant for somebody who's in their 40s, 50s, or 60s to start planning. And it becomes as difficult as it is you start aging beyond 70s and 75s and 80s, right? So therefore, I think this conversation should be had ahead of time. I think, as you rightly said, this conversation has to start now. Um, uh, Whether it is from a governmental perspective, I think these conversations are starting. Governments are trying to look at saying that, what should we do to make the society a good aging society, and a lot of learnings from many of the countries which have not done so well at this point in time. And from an individual point of view, I think it makes a lot of sense to have these conversations so that people start getting that awareness when they are in their 40s and 50s, and then start slowly moving towards planning for their what's called as their second innings. I think that's where such conversations are going to be very helpful, Arvind ji.
Yeah. I think one thing which I believe very simple, one word we usually forget to do is evolve. I think evolution, we keep ourselves stuck to one time, whether it is elders. Now, I have a 93-year-old mother, and she yet wants to feel and behave like she was 60 years old, right? So the point is that as we have to understand that, okay, today I'm able to do this. This is my reality. Let's do this particular thing. So it's very important for us to evolve. Whether a 60-year-old of yesterday was very different from a 60-year-old of today, and a 60-year-old of tomorrow is going to be a absolutely different individual. So I think this evolution has to continuously keep happening and keep in pace with the changing times. That's the repeat I would want to mention over here. I mean, that's what, unless you are flexible, if you're rigid, you're going to break. If you're flexible, it's great.
No, no, absolutely. I mean, just yesterday, last evening, I happened to meet Dr. Pratap Reddy. He was in Delhi to announce a few things. And look at that man at 93 years of age. And I'm not talking of just physical health. Fact that he flew down from Chennai to Delhi to have a meeting, to announce a new aspect of how they're going to be doing the business. But the mental faculties and his ability to not give up and see that, listen, what next? That excitement is very difficult to find. So, I love the word that you use, Dr. Reema. We need to help people evolve, and evolving is a mindset game. You know what? I personally think that what we should do is to actually help people create this mindset. And I think we need nobody's told me this unless I had met you. I had not thought of that I need to do something right now so that I could live independently. When I say independently, I don't want to be dependent physically to get up, somebody holding my hand to take me to the bathroom, versus also financial independence. So I think it's upon us to create this awareness, and uh, we still have the last opportunity to define what our second innings should look like. I personally, the word that comes to my mind is that life 2.0. It's redefined, evolved life that we should be living. And it's not about old age. It's not about retirement. It's about asking a much more positive question, because the the moment we think about old age, we think of negativity. हमारी हेल्थ खराब हो जाएगी, मेरे पास पैसा नहीं होंगे, मेरी इनकम नहीं होगी. uh, but I think, what can I start today so that my 70 or 80s can be healthier, more independent, more meaningful, more fulfilling. And that would mean thinking about money, thinking about movement, physical independence. Uh, it could mean relationships, finding your purpose so that you wake up with excitement every day. Our
I
mental
was just going to interrupt you to add the purpose to it. I think that is the cherry on the cake. I think we should be, every day morning when we get up, we should be looking forward to doing certain things. So yeah, I was going to add. I'm sorry to interrupt
Oh,
you.
no, absolutely, absolutely. And I want to end this conversation by saying that I commit that I will do my bit to spread through the conversations that I do, and I would really urge you guys to partner with me, and let's take this conversation forward, because Rima, what you said was a very beautiful thing, that it's a cultural issue. We don't want to talk about it. And you also use this word that age is hitting us, right? It must be, instead of it hitting us, it must be something that we plan for. And again, I want to repeat that, it's a mindset shift from being fearful of what could happen to, while you are healthy, while you are empowered to take action, you move that fear to preparedness, you know. So we can probably together through Life 2.0 kind of help people evolve and have a mindset which is empowering rather than fueled with fear. Do you agree with this?
Perfect. Yeah, absolutely, absolutely. I think it's the right approach, and I think a contribution, or if I may say, for the lack of better word, if I may say, leave a legacy for people to think positive and welcome another phase of life rather than being wary of it.
I think, it'll be very empowering. It'll be very fulfilling for us to make this contribution, not just for ourselves and beyond business to society. Raj, do you agree that we should look at doing something around this beyond business?
Absolutely. I think, look, every time we have met in the last couple of months, we've had such interesting conversations and very engaging conversations, beautifully prodded by you. I think that has also left a lot of thought process on the table for me and Reema. I love Life 2.0 that you just brought out. I think that's what it means. And today, when we are living in the technology world, I think Life 2.0 makes even more, sense to pursue. And I think I can speak on behalf of me and Rima. We'll be very happy to, join you in this moment of creating those conversations, and which will ultimately bring that purpose in life for people. That's what all of us have been talking about. And I just want to leave you with one thought, saying that, ultimately, this Life 2.0 conversations, in my view, will move the conversation from, growing old to growing gold.
I love that.
Wonderful.
I love that. Growing old to growing old. I think, and it's also very beautiful. Rima, you just mentioned that you were taking care of your old parent, and we know that by 2050 there are these published stats about how the aging population of India will be there, and we don't realize that we will have seniors looking after the super seniors, so we have no option but to be both physically and mentally strong to be able to do that for ourselves and for the ones that we care for. So, I think it's our duty to spread this word. I'm so glad that we are all on the same page. I'm going to take this initiative together with you, supported by you, to bring this Life 2.0 to life, and we'll make this beginning. Thank you so much, Raj.
Absolutely.
Thank you so much, Reema. I mean, this is such a beautiful conversation and very fruitful because we have actually come out with something concrete to do, and we'll put this to action immediately.
Absolutely. Excited, and thank you so much for this conversation. Looking forward.
Thank you, Raj.
Thank you
Thank
so
you.
much, Harbinder. Thank you.